this video, we're going to look at RTS, that is the renal tubular syndromes, and under that we are going to compare the Bartter syndrome. We're going to compare the Bartter syndrome with the Liddle syndrome, along with the Liddle syndrome. Now to get started, we are going to look at the Bartter syndrome. So let's write it down, the Bartter syndrome. So Bartter syndrome is nothing but it mimics the loop diuretics. It mimics the loop diuretics. So what is the defect here? The defect, it is a resorption defect. Reabsorption defect. So resorption defect, it lies in the thick ascending loop of Henle. It is in the thick ascending loop of Henle. Thick ascending loop of Henle. And what are the channels? It affects the sodium potassium chloride co-transporter. So it affects this. So what is the age group where this Bartter syndrome is present? So the age group, if you see, it is taking place in the childhood. So it takes place in the childhood. And what is the cause of this? The cause is that it is AR, that is autosomal recessive. Now when we look at the effects, it is the metabolic. It is metabolic alkalosis. There is the there is hypokalemia. There is hypercalciuria. Then there is also the mild. There is a mild hypomagnesemia. Now we'll move on to the Liddle syndrome. So under the Liddle syndrome, we are going to see the defect. So there is a gain of function. So the mechanism is that there is gain of function, and the gain of function mutation of the ENAC channel in the collecting tubule. So Liddle syndrome is a defect in there is an issue with the collecting tubule. So what is the age group of involved in the Liddle syndrome? So it is present in case of the young patients. So young patients with hypertension. Now we are going to look at the cause of this. So what is the cause? The cause is it is autosomal dominant. So most of the cases where we saw it was autosomal recessive, whereas here it is autosomal dominant and it affects the collecting tubule. So when we look at the effects, it is nothing but the metabolic alkalosis. Then there is the hypokalemia. Next is that it mimics the mineralocorticoid. The mineralocorticoid excess, but with low aldosterone. So this video is about comparing the Bartter syndrome with the Liddle syndrome, and we have explained it in the occurrence, where it occurs, the mechanism, the causes and the effects. To learn and grow daily, please do subscribe.